My child's behaviors have become so challenging. At home, at school, when we try to take them out, it's so difficult. It's affecting the whole family.
I'm sorry to hear that. It sounds like your child may need a functional behavior assessment, or FBA, so we can learn more about what's causing these behaviors.
FBA? What's an FBA?
A functional behavior assessment, FBA, is a process used to assess behavior and determine the function or reason that behavior occurs, in addition to identifying skill deficits. It combines information from multiple sources, such as direct observation of the behaviors in different environments, interviews with parents, caregivers, or school teams, data collection, data analysis, formal and informal skills assessments, and record review of the person being assessed in order to develop an understanding of why a certain behavior may or may not be occurring. Once this understanding is developed, interventions can then be designed to help address the underlying issues that are contributing to the behavior, including antecedents and consequences that are delivered when the behavior occurs. An FBA is an important part of a comprehensive system of support for individuals with challenging behaviors and can be used to develop behavior intervention plans, including strategies to prevent, respond effectively, and manage the behavior when it occurs. Ultimately, FBAs allow people who interact with the individual to better understand the behavior, resulting in more positive outcomes overall. The process of a functional behavior assessment can be broken down into 4 crucial steps: collecting information, analyzing data, developing an intervention plan, evaluating results, and making recommendations. Step 1. Collecting information. The first step in the process is to gather information. This includes a thorough review of any related records, such as school or medical reports. Interviews with parents, teachers, and other professionals can also provide valuable insight into the behavior. The goal is to get as much of a picture as possible of the person being assessed. Additionally, observations of the individual in various settings can give important clues about what may be motivating the behavior. Things such as antecedents, the thing happening before the behavior occurs, and consequences, how the behavior is handled after the behavior occurs, are also analyzed. Step number 2, analyzing the data. Once the data has been collected, it can then be analyzed and interpreted. The goal is to identify patterns in the individual's behaviors that correspond to certain situations or settings. These patterns can help to uncover what may be reinforcing or maintaining the undesired behavior. Step number 3, developing an intervention plan. After the data has been analyzed and a hypothesis has been formed regarding the function of the behavior, then an intervention plan can be developed. An intervention plan is a set of strategies to help manage and decrease challenging behaviors. The plan should include strategies to reduce or eliminate the undesired behavior, while at the same time teaching more socially acceptable behaviors called replacement behaviors. The more the replacement behaviors are worked on and consistently supported by family, teachers, and friends, the more likely it will be for the intervention plan to be successful. Step number 4, evaluating results. Finally, it is important to evaluate the effectiveness of the intervention plan. This will involve regularly monitoring the behavior to determine if it is decreasing, remaining the same, or increasing. If the behavior is decreasing, then continue with the intervention plan and make adjustments as necessary. If the behavior remains unchanged or increases, then it may be necessary to revisit earlier steps in order to identify additional strategies that could be effective. Taking consistent data is imperative. A functional behavior assessment is an important tool used to determine the function or reason for challenging behaviors, identify possible skill deficits, and to identify strategies for preventing or managing them. It provides insight into why the behavior occurs, how it affects others, and what interventions can be put into place to help support positive change. FBAs are important tools that can help caregivers better understand the needs of the individual they are taking care of and create effective interventions or responses that can help minimize or eliminate the challenging behavior. This in turn leads to improved communication, safety, cooperation, and overall the well-being of both the individual and those around them. By conducting an FBA, families and caregivers can gain a better understanding of how to best interact with and support the individual to foster positive behavioral changes.